My name is the Regional Coordinator for Southern Africa, Region CDC based here in the South African country. Today, ladies, I will have the privilege to introduce our guest. Our guest is Dr. Ahmed. Currently is serving as a Deputy Director for African CDC based in Addis. Dr. Omar is on official visit for 3 days. His visit is threefold. First is to provide strategic vision of the African CDC. Also is here to say thank you to the people and also to the government of Zambia for graciously accepting to host the summit in Lusaka. Also to provide additional guidance on what the African CDC is doing in context of the COVID-19, like additional guidance in the most important issue we are facing is the vaccine for the COVID-19. So what countries should be doing in securing? So in brief, Dr. Ahmed, prior to join the African CDC, he has the rich experience in global health. In fact, he has the opportunity to serve globally with the World Health Organization in Geneva. Additionally, also he served in regional office in Congo, Brazil. Most importantly, he had an opportunity also to serve the Minister of Health of the government of Kenya for many years. Today, we are privileged to have him, and he will be confidently share with you. And I have the privilege to introduce him and to welcome him to the home. You have the floor.
Thank you very much, Dr. Ludwig, Coordinator, Africa CDC, Southern Africa Region. Good morning, ladies and gentlemen. It's a pleasure to be here. We wanted to give some updates on why I'm here in the Southern Africa region and specifically in Zambia, where our regional collaboration center is located. So first is I have had very fruitful discussions with the government of Zambia. Met with the Minister of Health, met with a senior official of the Foreign Affairs Ministry, met with very key partners who are based here, the World CDC offices here, the World Health Organization. We have been discussing how to strengthen our support to the countries that are in this region, the Southern Africa region, Zambia, as well as how to leverage our various strengths to ensure that Africa secures itself, not just for health emergencies, but also aspects of society that have an impact on health in general. So it has been very, very successful. I am very happy, and as I go back today, I'm sure you will be seeing a difference in how Africa CDC, indeed Zambia as our host, we will be approaching the issues of global health security, particularly public health outbreaks and emergencies. As you may know, as of today morning, we are over nearly 2.3 million cases have been documented on this continent. That is way, way below what had been predicted at the beginning of the pandemic. Many people around the world have made the very wrong assumption that Africa will not be prepared and we will be seeing huge numbers of those who are unwell, those who are hospitalized, and those who are dying on the continent. We have just crossed the 54,000 barrier for those who have unfortunately lost their lives, which is just about 2.4% case fatality rate. But I must say that as Africa, we have extremely worked in making sure that the numbers of those who are infected is low, much lower than had been predicted. The numbers of those who are recovering is very high. We are at about 80% recovery rates have remained low, much lower than the global average. And we as African CDC in our role as coordinating the response on the continent intend to do more as we do the following months, particularly during this holiday season that is coming. Third is what is guiding our response on the continent is the Africa Joint Continental Strategy for COVID-19 outbreak, which was passed by our Ministers of Health on the 22nd of February of this year, a week or so after the first case was documented in Egypt on 14th of February. Our Bureau of Heads of States of the African Union also endorsed that strategy about a month later on 26th of March. And we have been using that strategy to respond to COVID-19 preparedness and action on the continent. That strategy has really been the cornerstone of the success that we've seen on the continent. Let me also add that very recently, we did, in October, we did have a high-level conference for vaccine strategy, which was also adopted. And we are using that vaccine strategy to plan and prepare for not just the availability of vaccines, but also vaccination itself. And I will touch on that a little bit later. So to come to the situation in Africa, we are seeing a second wave since October. The second wave is not uniform across Africa. It is being driven by certain countries because of the different socioeconomic and particularly environmental factors that exist on the continent. As you know, Africa is very diverse with 55 member states and spanning across very many different weather patterns. If we look at Zambia, then your numbers here in Zambia have been relatively stable and low after the first peak in mid of July. But continentally, from the middle of October, we have been seeing a rise in the second wave. But I must add that the curve is not as steep as the first wave, and we expect that when it peaks, it will peak at a much lower level than we saw with the first wave. Our response as Africa CDC is across the continent, not only in the hotspots. The hotspots, we give them detailed attention, but our response is across the continent. And our intention is to implement the strategy in a way that keeps our numbers low, in a way that ensures that we're opening up the economies in a responsible manner, and going back, not to complete normal, but going back to being able to carry out our daily activities while respecting the public health measures that have been put in place. To this end, let me be very clear that although we are waiting for the vaccine, what we have seen is going to be most critical, whether we have vaccines available or not, is our personal discipline. And that means respecting public health measures, keeping your distance, wearing your mask, washing your hands, indeed ensuring that any small symptoms that you may get are properly addressed in good healthcare facilities. We do not want the continent to imagine that when the vaccines, as they are starting to do, that we can go back and ignore public health measures. Public health measures remain the most effective tool that we have to keep the numbers low and combat this pandemic. The final thing I would like to say is around the vaccine. We have vaccines that have received emergency use in Europe, in the United Kingdom. And there's every indication that within the next week, it will also receive emergency use authorization in the United States of America. As Africa CDC, we are coordinating very closely with manufacturers so that we can be able to get appropriate vaccines coming onto the continent. The vaccine, COVID-19 vaccine strategy that we have has three main goals. The first goal is vaccine development. We want Africa, and coordinated by Africa CDC, to be part of vaccine development in the world. We want that when vaccine candidates are being produced from the lab to come into clinical trials in human beings, Africa is part of it. And the reason for that is we want to be sure that when numbers are being compiled globally, African numbers are part of the number. We want our specialists, our scientists to be part of vaccine development, especially clinical trials. And we have identified adequate clinical trial sites on the continent that are ready. Some are already working, and others we are waiting for them to begin to work. And as Africa CDC, we are providing that coordination. The second goal of the strategy is really equitable access. You will recall, I don't know whether you are old to recall, but from the middle 1990s to the middle 2000s, Africa lost 12 million people to HIV and AIDS. And the primary reason for that was because therapy was too expensive for the African governments to afford, and therefore access was extremely limited. Today, when therapies are more easy to access and have become more affordable, we are no longer losing as many people. We don't want that to happen to COVID-19. It's a lesson we have learned, and we intend to use that lesson to ensure that we get